Welcome to today's session of one of a set of informational roundtables that we've been hosting. This information is so that we can pass along relevant information to our existing and newly admitting nursing students. In today's chat, we will address what to expect when on campus for nursing skills labs or simulations while we're all still dealing with COVID-19. Today, our guest that I'll be interviewing is Mr. Singleton. You guys know Mr. Singleton.
Welcome back, guys.
Let's start off with maybe help explain what can the students coming for labs this fall expect?
Okay, so you guys aren't new to the game of nursing simulation and nursing lab, but on campus, this is going to be a change for you. Okay, so there's quite a few new things that have been implemented to make sure that we're maintaining as much of an area for safe being and safe practicing as possible. So I'm just going to go down a list of some of these things, and most of them are common sense, but just things that you need to be prepared for, and just go ahead and kind of set yourself, not thinking it's one more thing to do, but thinking, hey, this is what we need to do as mindful healthcare practitioners to take care of ourselves and one another. So per our campus policies, all individuals coming to campus must complete the COVID-19 questionnaire. Okay. You must wear a face covering at all times when on campus, and you will have to have your temperature checked just to even get in the building, right? So for those entering the skills and or the sim lab, you will have to have your temperature checked again at that point, right? And if no fever, we use the CDC guidelines for what is a fever as it applies to COVID. Then you will sanitize your hands and you'll put gloves on. So mask, gloves. And one point to make is when you're wearing a mask on campus, you can wear the campus approved masks. When you come into the skill or sim, you have to wear a surgical grade mask, okay? So once gloved up, you will scan your student ID badge at the kiosk and you will check into the class that you're there for, okay? A staff or faculty will direct you to your assigned practice area at that time. Okay, so in your past, you're familiar with, you come in, you kind of find your spot and you go work, you work wherever there's a space. It's not going to be like that now. Everyone's going to have kind of an assigned area because we have to make sure that we've created a safe working space for everyone. So there's no jumping around, there's no changing your space. We each stay in our own spot to make sure that there's safe space for everyone, faculty included. So any lab equipment that you need will be provided, and depending on the tasks, additional PPE will need to be donned. In some cases, we will provide that, and in other cases, it will be something that you're responsible for, and we'll let you know what all that is ahead of time, of course. Each group entering for a scheduled practice session will only be able to stay for as long as you were scheduled. So at the conclusion of the session, an announcement will be made to prepare to exit, okay? There is no, we come for a 30-minute scheduled time and stay for an hour. You'll have to stick to the scheduled time, so you want to be focused on the matter at hand while you're there. So prior to exiting, any required PPE will be removed and properly stored. Of course, if we store it, it will be cleaned in between uses or discarded, and it will be discarded per policy, okay? You will scan your ID badge to log out of the practice session, and at the exit, hand sanitizer will be available to use again. And I'm pretty sure you've all heard me say this, but infection control, infection control, infection control. And that was before COVID. So add 3 more infection controls at the end of that, and then you've got to start, okay? So you are to exit the building as soon as your time's over. So anytime you're on campus, you have a scheduled time, you're there for that scheduled time, and then you're out, okay? So there won't be any gathering in hallways or other areas inside the buildings, okay? You have to keep that social distance at all times when on campus. In an effort to minimize groups and potential contact, exposure plans have been made to have many skills demonstrated virtually. You're probably familiar with that somewhat, right? And to assist in this, specific kits are needed. So this part may be a little different for you, right? These kits will be checked out and they will have to be checked back in 1 week later. A limited number of models and supplies have been purchased or constructed to make these kits for you. And failure to return one on time will prevent a classmate, a teammate, from getting their time, their 1 week to practice and demonstrate competency on that skill. So this is a classic golden rule scenario, which all life should be a golden rule scenario. If you keep it longer than it's assigned to you, someone else gets less time with it. So you have to be very vigilant about being a good teammate, right? So that everyone gets a fair shake and a fair time with this.
Okay. Since these are existing students, I thought maybe it might be helpful for them to understand why we're having to be so strict about the time constraints. And so I just wanted to say that's so that we as your simulation skills lab staff and faculty have time to do the proper cleaning and disinfecting before we can let the next group of people in. And you have to allow for what's called dwell time of the disinfectant product. And that adds time onto everyone's day and it adds blockages to you getting in. It's similar to like a simulation schedule. If you don't stay on time, then your group is waiting longer. And by the end of the day, someone could have waited way longer than anybody else. So we're just trying to be cognizant of that and keep things moving safely for everyone.
Exactly. And as students who have been in clinical situations, you may or may not have seen this, but in the real world, if things are done correctly, if you are in an isolation room and you have equipment in there, say the patient leaves and you have to clean the room, right? It takes a while to clean the room, or if you remove a piece of equipment from that room, it has to be thoroughly cleaned. It takes time. We want to do it right. We're not cutting corners on this. We don't want you to cut corners. We're not going to do it.
Mr. Singleton, can you just explain maybe if you know what the process for checking out the models that were mentioned, how we'll do that?
Yeah, right now, that is something that we're still working on. We're still deciding to make sure that we get the easiest to use system, the most efficient and the best for the students and for us to be able to keep those clean. So we're trying to get a way that, we can get it in, get it clean, and get it back out as quickly as possible and efficiently for everyone. And we'll have additional announcements or a future roundtable chat like this to make sure that that information is gotten out there.
Okay. So I think I know the answer, but I'm going to ask the question. Can students come and practice anytime they wish in the skills lab in fall?
Well, everyone remembers the open lab schedule and how open and how many hours were available. And unfortunately, at this time, the answer to that will be no. All lab practice times will be almost entirely all virtual, and they will need to be scheduled clearly because we're going to want to have someone there observing to make sure that you're honing those skills to the point that you're demonstrating competency, right? So in the rare case where virtual assistance is not sufficient for mastery of the skill competency, then a face-to-face appointment can be initiated. That too, of course, will need to be scheduled, and we will we'll do everything we can to kind of work that in if it's needed. But that's something that would be discussed ahead of time if that was needed. And while we're on the subject, could just focus on the possibility of change to this policy as well. So there could be, for example, someone in the department who maybe has a COVID exposure, and we have to shut down all on-campus activities for a certain period of time. So in that case, we might not be able to do any face-to-face, but again, we would, redouble our focus on ensuring that the virtual is going to really be able to get that demonstrated competency, giving the extra time and assistance needed.
That makes sense. So can you explain how students will schedule those virtual open lab appointments?
Yeah, Dr. Franklin, aka Batman, will post information in whatever the course is, whichever course you're in this fall, with the open lab virtual sign up schedule, right? And just so be looking for that resource in your course as soon as classes begin, okay?
Excellent. This has been a really good session. I think the students will be happy to hear this information ahead of time. They're probably wondering what things are going to look like. So thanks for taking time out of your day today.
Yeah, absolutely. And I hope everybody's safe and well, and look forward to seeing you again in the fall.
See you guys soon.